Hello, Ben. You might gather we're not on site today. We're nice in the nice, cosy, warm offices of Guard Archaeology through here in Glasgow. Now, we thought we'd look at what we actually do about human remains and actually how we actually identify human remains. Today we've got our forensic osteologist expert from Guard, Araya. Hello, Araya. And Araya's going to tell us just very quickly about some of the differences between a male and a female, male and female skeleton, and also maybe some obvious pathologies. We're only at the start of what is going to be a long process of full identification and pathology going forward. So, Araya, thank you for meeting us today. What we have in front of us is, I believe, a male burial from Constitution Street in Leith. Can you just sort of maybe tell us some of the obvious things you look at in the lab about sexing this individual and maybe about its age?
Okay. The first thing we will look at is the skull and the pelvis. The pelvis will be the most reliable traits, it will show the most reliable traits because the biological differences between a female and a male. We are not talking about gender here, we are talking about the biological sex. In general, when we check the skull, the men tend to have like a very prominent, what is called glabella in here, while female tend to be more flat and they don't have this big prominent.
Sort of an eyebrow ridge, some people might call it.
It's to do with muscle, and it's to do with the fact that the men usually are more muscly than the females.
Yeah.
And this is the same. This is the mastoid process, and it's kind of like it's chunkier usually in males. You check the orbit of the eyes. In this particular case, it's a bit in between. The men tend to be like proper rounded orbital edges, and this is not as much. They are square, which is also a male trait, and there is this another muscular attachment in the nuchal crest, which is also quite prominent. You can see it has like a peak.
So very prominent ridges, and that's really for where the muscles and the ligaments attach to the skull, isn't it?
Yeah. So you look at all these different traits, and you score them as you go along.
Okay.
You can also, obviously, you will be looking at the mandible, in which the males usually are more square, and the females is more like this kind of shape is this, and the male will be more square.
Okay.
But in this particular skeleton, we have the pelvis. So we check this angle.
Yeah.
In the men is much more narrower. In the females is much wider.
Okay.
If I show you here, so we can compare and it's easier to see the differences. This is a female pelvis.
Oh, yeah.
The females' pelvis are much wider because they will be maybe at one point.
Probably to show the. I'll hold the other one.
Oh, brilliant! Thank you so much.
So it is just together.
This, which is the.
See the sort of. It is pronouncedly sort of almost.
So much different.
Yeah.
This is kind of like you can say like 90 degrees, and that it becomes so narrow.
So, why is that?
Because the females are childbearing, so the pelvis needs to be much wider.
Yeah.
The males tends to be taller. So when you put it all together, which I can do it with the male, but I cannot do it with the female because I only have one pelvis left. Can you see?
Yeah.
It's so much. It's taller. The female pelvis will be like this.
So
to kind
sort
of
more
have
narrower
space.
hips than a sort of wider hip.
Yes. So that's the same as with the skeleton, with the skull, excuse me. You check the angle in here, you check if this is broad, you check the size of this one and the shape of this.
Okay.
So there are a lot of different traits that we will be looking at, the pelvis, and scoring them. And after you kind of do like, okay, is a male, or is a possible male, or is indeterminate. Indeterminate is those skeletons, subadults, because they are not grown enough to show the sex.
I was going to ask you, because obviously the skeletons change through time and age differently, so obviously there must be some that, I suppose we're all different shapes and sizes, so there will be ones we can't actually say, because people say, why can't you tell it's a male or a female? And that's...
For instance, this one, like the pelvis itself is very male, but if I only had the skull, there are few traits that is like, oh, this is more like a female, but that's more male. So I may not be as confident as saying it's a male. if I have only had the skull. In this particular case, it's great because the more you see, the better the bone is, the more of the bone there is, like preservation-wise, the more you can tell about the skeleton and the person.
I think that's very important, and it's just obviously we need more. Why people say, well, why can't you do this? Because you need those indicators. Is there any other? I mean, well, they're the main ones, and obviously the skull and the pelvic region are obviously the main ones. Could you say? I mean, people ask, can you say, you know, from the arm bone or from the ribs or any other? Would they suggest sex?
You can also take measurements. So
okay.
Measurements of the femoral heads, the humerus, they have been studies done, and we could compare those, and there will be a range of measurements that it will be more suitable to men or females.
But
so
maybe,
there are other things that
maybe
you can
less reliable, a lot less reliable. Obviously,
yeah. Because like there are women that they are actually. You know, like you are in a site, you see a skeleton on the ground, and just from the side, people will assume, oh, this is a man.
Yeah.
And after when actually check the pelvis,
Yeah.
it's like, oh,
no,
it's just a very big woman.
Well, we're all shapes and sizes, aren't we?
Exactly.
And I
Vice
think,
versa.
well, that's why we do the forensic analysis, is actually getting that finer detail to put the picture on these individuals. I mean, before we go across to this lady over here, is there anything about this burial? I mean, I know you've only just started the forensic analysis, and there'll be a lot more as we go forward. Is there anything that just stands out? I mean, obviously you do a quick assessment. Is there anything maybe about the age of the individual possibly, or any sort of?
The age, I think, is like, the age is also, we will be getting an age range. We are getting the biological age.
Yeah.
We are not getting the chronological age.
Yeah.
So some people may age biologically sooner than what their age is from circumstances. But this one, so with age, what I was leading to, you get a range of like maybe 10 years.
Yes.
So it's, you know, you do try, but the best for aging, the section was for adults. The sub-adults are, you can actually get a better range because you look at the development and how the kid is developing. But this one is gonna be like the same. You also need to check. There are techniques that we apply. You check at this pubic symphysis and how you are looking at the degeneration of those ligaments and joint surfaces. And we look at this one, which is auricular surface. There are those two techniques. You will check the wear of the teeth.
Yes.
In this particular one, it does have a bit of wear in the first molar, but the third one is not hardly touched. So, you know, and you check the fourth rib, but I don't think I have. The end of the fourth rib is the same thing. You check for, you know, like when the body starts to get older, you get more ridges and things like that. And you get, this is not a sample because it's not the fourth.
Yes.
But this is kind of like a scoop. When the skeleton is younger, you get these kind of ridges like this. And when it's grow older, you get like spikes of bone coming out.
I mean, it's not the general wear and tear, which we'll go into. We all suffer from it.
And it's the cartilage getting old, becoming bone.
And also just generally, as we grow, we sort of, is it true, we sort of stop growing late teenage into early 20s, is that true? Because that's when, there's something about the fusing of the ends of bones as well, isn't it?
Yes, so there's this one, the acromial end is the one that will fuse one of the latest.
Yes.
So it can help you out. Usually our cutting point to say a skeleton is adult or sub-adult is the coming out, the eruption of the third molar, the wisdom. As long as you have the wisdom tooth, you're an adult. Now, I don't know how true that
is. Well, I better watch that because mine haven't come through. But that's something else. Which is a common, I should say, it's a common thing that I think it's coming more. The wisdom teeth in a lot of adults aren't coming through. They're impacted more and more. It's a common genetic thing.
Yeah, I think we are it's part of evolution. We are not using them as much, so they become obsolete.
So I think that's good. Is there any Just a bit quickly on this one, is there any sort of
This
obvious...
one I had a look, checking for the fractures in the ribs. It has bone
Oh
growth
god, that, yeah.
on quite a few. You can see these are the thoracic ones, the thoracic vertebrae, and this will be the lower vertebrae. So it shows that this person may have had, you know, quite a mechanical stress, activities that involve a lot of physical work.
Yeah.
And actually, when we were looking at that one, this skeleton also had similar, even a wee bit more. You can see how.
Yeah.
Sure, I try to show you. Oh no, it's not this. But there are some of them are even getting fused together.
Yeah. So
No.
we've sort of moved, obviously, from the gentleman. So maybe if you now across here.
There.
Oh yeah, I mean that's osteoporosis maybe or something.
Osteoarthritis.
Yeah, yeah.
The spine is. It has other lesions in this particular one. You see this?
Gosh.
That's called. I don't know if I pronounce it well. Schmollsnut.
Yeah.
But it's also mechanical stress. It's kind of like an hernia on the. You will have a spongy thing, and the you know.
It's extremely bad, painful back. This poor woman suffer from.
Yes,
Yeah.
yes. Which is a sign of the, you know, the physical activities and the work.
Yeah. So, all right, we moved across from the gentleman to this female skeleton. So, same again. Obviously, we've talked about the pelvis and the differences. How women's obviously got the pelvis is geared for childbirth and it's wider and it's got the things there. So, just maybe go through this one and tell them something. Can you show some of the differences why this is you think is female rather than male, and obviously sat with the skull.
Yeah. The edge of the orbit, it will be sharp, and hope you can see it doesn't have such a prominence in this region. Often the females will have like a what's called bouncing in here, like a I don't know how to explain, like a rounded.
Oh yes,
instead of being flatter, like the male will be, you will have like a round here.
So
here.
maybe a bit more flatter.
It's like here you get it in the parietals, in these to the sides of the bone and in the frontal.
And you can also see, I mean, just generally looking at it, it's a lot smoother, smaller.
Much smaller, yes, bead.
Yeah.
It's as we talked before, you can go with size, but you can't use this as a parameter.
So it's putting all these little small little things together to give that sort of rounder picture.
See, if you see the mandible, it's so much narrower.
Yeah.
The man will be much broader in there.
And slimmer as well, often as well, isn't it? Yeah.
Yeah. In general, you can actually see it in the skeleton when you're laying down. You know, they usually will be more fragile. However, you may get differences between times.
Yeah.
Like if you see a Victorian skeleton to compare to a Roman one, the more Roman ones were like using
more manual
muscle.
labor something. And there was just from the last one, just talking through it, we do have at least traits, shall we say, of women and men of having quite large jaws.
Yeah, I saw it in the book.
Yeah. So, but that again, it kind of shows the worth of doing your work. Is actually can't make those assumptions just because it's got big, heavy.
Because those traits could be part of the environment and could be part of that particular population. When you check other populations, like you kind of see this. Like I remember I was checking another skeleton from Aberdeen, and the back of the skull they had this kind of like a lump.
Yes.
It was nothing wrong with them. They just had like a massive lump, and there were a lot of them.
It's genetics, isn't it? So it's like that family trait that will just go through.
Or the environment, or whichever it was causing. Those you also mark when we're doing the analysis. You check the how good the bone is in terms of preservation.
Yeah.
And how complete the skeleton is, and you take a lot of measurements, which if you get the sex of the skeleton, you can actually get the stature if the bone that you're using are complete. Yeah. Obviously, if I only had that one down, it's fractured, I cannot use it. But you get you can apply formula, and you can use the humerus, the leg
Yeah.
bone and
To give it that
combine
sort of,
to
all
get
the
a
results.
structure.
Yeah. So in
Yeah.
terms of this woman here, as a female, is there anything sort of? I mean, I know we just started looking at her. And you said she's got she's got really bad backs of osteoporosis or rheumatoid arthritis. Is there anything else you've
Yes.
seen immediately that jumps out at you?
Apart from the poor thing, the teeth that she has, because she has, you can see here, a hole, and that's like the enamel, the white of the teeth has completely gone, so it will probably has had a caries.
Yeah.
And after this will be an abscess, which you can just imagine the pain of the
I can.
person. And there is another, it kind of fell, but it's, it should be, anyway, there is another one here.
Oh,
So it
God,
has
yeah.
both sides. That will be extremely uncomfortable. You can see there,
It's
that's the caries.
eating away at the teeth and the bone as well, isn't it?
The teeth is gone,
Yeah.
and what is happening now is affecting the root.
Yeah.
So it's even more painful, and that can actually go into your bloodstream and
Yes.
cause a proper infection. You know, so it is dangerous. We are very lucky to have antibiotics. It's
Well,
like, yay.
I think this is what we're talking about when we talked about some of the other reports. Is that to survive past 35 and 40, 35 to 45 in basically before the 19th century industrialization, you're doing a very good job, because you
Yeah.
die of just things like septicemia or something, or infections caused by that in the bloodstream.
Yeah,
it just
that-
brings it to life. Yeah.
That nowadays you go to the dentist and you are fixed.
Yeah.
You know, it may take a while, but
Yeah.
you will be.
Or a dose of penicillin or something, and you're gone.
This one, we are lucky because it's broken,
Mm-hmm.
but we can actually see the maxillary sinuses.
Yeah.
And in there, I don't know if you're going to be able to see, but there is bone growth.
Right. Okay.
It's those spiky little things, like quite irregular shape. And that means that has been an inflammation or an infection, which probably is a maxillary sinusitis kind of thing. And the person had been living with it, could look like it's inactive. Which is like, it kind of, it makes sense. Sometimes they have done studies in the past, and often maxillary sinusitis affects more of females population than you could do comparisons after when we gather all the data, because they may be more in the house next to the fire.
It's that, I suppose we don't really appreciate it because, I suppose the climate change and all this is really thinking about how the environment we live in today and air quality. We have different bad qualities today, but in the past, the London smog was a classic example. But even just, I don't know, what's it used to call the black houses in the Black Isles, where you actually, in a small room, and it's just all that smoke, because it's burning wood. I think it's just like...
And if you are the one that is going to be cooking and minding the fire, you are constantly getting that smoke.
And it's just that constant, and it sort of brings, there's a big article recently about India, and I've been to Delhi, and you can actually see, because they use a lot of the same smoke, it's like wood burning, you actually see the particulates in the air. At night, and it's just really, just at night with it's like going through smog, and it's because it's wood burning. At that time, that was about 20 years ago.
Yeah.
And it just sort of brings it back to
that.
that.
Well, you were talking about the London smog, and even that in industrial cities, it was linked with rickets and the lack of sun, that they will be endured and after cause that. So it's,
And as we're saying, Alan, we're just really at the start of the investigation. These are sort of the questions you'll be looking at, and we'll be looking at, about the life of those individuals, what the bones can tell us about, working conditions maybe, and the life, what they died of. But it leads into that sort of health issues, which we might not tell from that, but we can surmise by looking at what we do today.
Yeah, no, or looking at other samples from the parasites that we're looking, because those things, they may know. There are a lot of diseases that do not leave a mark on the skeleton. So it's that you have a glimpse of what the health and the disease would have been in the past, but you're only getting a glimpse. You are getting those skeletons, those people that they have survived the disease long enough to leave a mark on the skeleton, and not only those diseases that they may leave a mark on it. So pathology, in regards to the parasite analysis, that's going to be really exciting. because it's going to show us another.
There's another building block to
Uh-huh,
how we actually understand these people, and
We'll
it's,
get a better picture.
yeah, and hopefully we'll do that, and it'll be some maybe the first times we've actually done it, certainly in Edinburgh on such a scale. But I think it's really exciting what you're doing, and
Mhm.
thank you very much.
Okay, thank you.
Thank you.